Friday marked the 2-year anniversary of the World Health Organization declaring COVID-19 a pandemic. Now, with cases dropping and COVID restrictions lifting, we want to take a look back with our medical expert. Dr. Arnold Baskies is the past chairman of the National Board of Directors of the American Cancer Society and recent appointee to the World Health Organization's Global Breast Cancer Initiative. Hey, Dr. Baskies, good morning.
Good morning, Francis.
It's hard to believe it, but 2 years. Looking back, what did medical science get wrong and what did it get right?
Well, let's discuss first what we got right, Francis. The vaccines work, and the technology behind the vaccines was about 10 years old and needed to be reinstituted and formulated in a way that we could make vaccines very quickly. So we learned very quickly that the government and pharma can work very well together. What we got wrong is a little bit of a different story. The CDC messaging was at times confusing and didn't direct us in the right to the right spots we needed to get to. So I think the CDC learned a lot of lessons here. We also learned that lockdowns and isolation are harmful. It's a lesson well learned. And lockdowns don't stop a pandemic. They slow it down, but they don't stop it. So those are the things that we got wrong. What we learned, however, is that pandemics are inevitable, unfortunately, and the next one will come. We don't know when it'll be, but we need to be ready. We need to have things stored. Personal protective equipment needs to be stored and ready to be used at a drop of a hat. The public health institutions in the country need to be supported with dollars from the federal government. That's what we learned. And I think we'll be in a better spot when and if another pandemic comes.
All right, Dr. Baskies, thank you very much for joining us, and thank you for all your insight these past 2 years. I know I'm relatively new to the team, but I've heard nothing but amazing things about you and your expertise. So thank you for that.
Thanks, Francis, and I want to wish everyone a good rest of the weekend, and hopefully we're at the end of what has been a very, very bad episode in our medical history.
Yeah, hopefully see you later, but for maybe something a little more positive.
I hope so. Thanks.
Yeah, all right. Thank you, Dr. Baskies.